Okay, let's unpack the scenario. You've been playing with your cat, right? Maybe things got a little too rough, you get a scratch, and then maybe a few days, a week later, you feel this like swollen, tender lump maybe in your armpit or neck. What is that?
Yeah, what's going on there? That really brings us right into our deep dive today, which is
And
all about Bartonellosis.
yeah.
It's considered an emerging infectious disease, and often, yeah, it ties right back to our cats.
Our feline friends?
Yeah.
Okay.
And what's really fascinating, I think, is that while a lot of people might know that basic cat scratch scenario,
Yeah.
this thing, Bartonellosis, it can actually present in a whole bunch of ways, some quite surprising.
Really?
Yeah, so the sources we're looking at today, they give us a pretty thorough overview. The basics, what it looks like in people and animals, the bacteria causing it, how doctors figure it out, treatment, and maybe most importantly, how to try and avoid it.
Right. So our mission then, for you listening, is to sort of demystify Bartonellosis. We want to give you a really clear picture, not just the usual story, but also some of those less common, maybe unexpected angles of the infection.
Exactly, like how it actually travels between animals and humans and the key things to be aware of. We'll try to do it without drowning everyone in a super technical medical jargon.
Keep it straightforward. So let's start with the culprit itself, the bacteria.
Okay, so at the heart of it all is Bartonella bacteria. They're described as small, curved, gram-negative rods.
Hmm.
And what's really unique about them is how incredibly adapted they are to specific animal hosts.
Adapted how?
Well, they don't just, pass through. They manage to set up shop long-term, establishing a chronic infection right inside the red blood cells of these reservoir hosts.
Inside the red blood cells. Wow, that's
Mhm.
that's pretty specialized, isn't it? So they're just hanging out in the bloodstream for potentially a long time.
Exactly, living quite comfortably in there.
Okay, so if they're inside the blood cells, how do they actually get from one animal to another or to us? It sounds like they'd need some help.
They absolutely do. They're primarily vector-borne, which basically means they rely on other critters to transport them. Think
Yeah.
fleas and ticks mainly. They're the little taxi service for the bacteria.
Ah, fleas and ticks. Makes sense, yeah. They bite, they transmit stuff. So that brings us to the most common way humans encounter this, cat scratch disease. Most people have probably heard that term, right?
Definitely. Cat scratch disease, or CSD. And yeah, as the name pretty clearly suggests, it usually starts with some kind of contact with a cat.
The classic scenario. So walk us through it. Someone gets scratched, maybe bitten by a cat carrying Bartonella. What typically happens next?
Okay, so the usual progression, according to our sources, begins with a small, maybe reddish, raised spot, technically an erythematous papule, right there at the scratch or bite site.
Okay, a little bump first.
Right. Then, usually within about 3 to 10 days, the next thing that typically pops up is what's called unilateral regional lymphadenopathy.
Whoa, okay, break that down.
Sorry, yeah. Basically means swollen lymph nodes, usually painful, sometimes even pus-filled suppurative, but just on one side of the body, in the region near where the initial scratch or bite happened.
Ah, I see. So if you got scratched on the hand, maybe the lymph node in your armpit on that same side swells up.
Exactly. And this happens in the vast majority of cases. The sources say over 90% of CSD cases present with this regional lymph node swelling.
Ouch. That sounds uncomfortable. A swollen, tender node near the scratch. Pretty telling sign, then. Are there other things that might show up alongside that?
Yeah, you might also get some other sort of general symptoms like a mild fever, just feeling generally unwell, malaise, maybe loss of appetite, some muscle aches, perhaps even a bit of nausea.
Okay, so feeling kind of crummy overall.
Pretty much. But here's the good news, and the sources emphasize this. Cat scratch disease in most people isn't generally fatal, and it often resolves on its own without specific treatment.
Oh, that is good news. A relief, definitely. Still, it sounds like it happens reasonably often.
It does seem to. The estimate mentioned is over 25,000 cases per year, just in the U.S. And while most people recover at home, over 2,000 cases actually require hospitalization each year.
Wow, okay.
Right.
So not insignificant.
No. And there's also a bit of a seasonal trend. Noted more cases seem to pop up between July and January.
Interesting. Maybe related to flea seasons or something?
Could be, yeah. That seems plausible.
Okay, so that's the typical picture. But you mentioned earlier, and the information highlights, that Bartonellosis can show up in some less common or atypical ways. This is where it gets really interesting, you said.
Yes, this is where you really see the variability of this infection. The sources suggest that up to maybe 25% of cases can present atypically. And some of these presentations can be frankly, quite serious.
Okay, like what kind of things are we talking about?
Well, the list includes things like encephalopathy that affects the brain, causing confusion or altered mental state, pulpeural conjunctivitis, which is inflammation involving the eyelid, even meningitis, inflammation of the linings of the brain and spinal cord.
Whoa. Okay, those sound serious.
They can be. Also, things like optic neuritis, affecting vision, osteolytic lesions, which means areas where bone is actually being broken down, and specific kinds of inflammation in the liver and spleen, called granulomatous hepatitis or splenitis. Even pneumonia or endocarditis and infection of the heart lining have been reported.
Gosh, that's a much wider and scarier range of possibilities than just a swollen lymph node near a scratch. It really shows this isn't always simple, does it?
Absolutely. It underscores that while CSD is the most common phase of Bartonellosis, the bacteria can potentially cause trouble in many different parts of the body.
Okay. So what about the animals themselves, particularly cats, since they're so often linked? How does Bartonella affect them? And you mentioned dogs, too.
Right, that's a key part of the story. With cats, it's actually quite interesting. Very often, they show absolutely no signs of illness. They seem perfectly healthy.
Really? Even if they're carrying it?
Yeah. The seropositivity rate, meaning evidence of past exposure in their blood, can be pretty high in cat populations. Depending on the location, it could be anywhere from 5% up to 60% or even more. But clinical signs are rare.
So most cats are just silent carriers.
Largely, yes.
Yeah.
Our sources mention some rare potential signs, like maybe some lymphoid hyperplasia, which is like enlarged lymph tissue, maybe uveitis, eye inflammation, very occasionally endocarditis, or just a self-limiting fever that comes and goes. But mostly, they seem fine.
That's kind of wild. Your cat could seem totally normal, but still potentially pass it on. What about dogs, then? You said there's an emerging clinical picture there.
Yes, with dogs, the understanding seems to be evolving. We're seeing reports linking Bartonella to a wider and often more serious range of clinical problems than we typically see in cats.
Like what sort of problems in dogs?
The list includes things like endocarditis and myocarditis, inflammation of the heart lining and muscle, granulomatous lymphadenitis, those swollen nodes again, but with a specific inflammatory pattern, rhinitis, like a persistent runny or stuffy nose, vasculitis, which is inflammation of blood vessels, also eye problems like uveitis and chorioretinitis, arthritis, joint inflammation, meningoencephalitis affecting the brain and its linings, and even blood-related issues like anemia or thrombocytopenia, which is low platelets.
Wow, so it sounds like it can potentially be a much more significant illness for dogs compared to cats.
That seems to be the picture emerging, yes. A broader range of potentially serious issues.
Okay, let's circle back to the causes and risks then. We know cats are involved, especially with CSD. What else do we know about how people or pets get this?
Well, the link to domestic cats, particularly kittens, is really strong for human cases. Over 90% of people diagnosed report contact with cats. And specifically young, often flea-infested cats seem to be a key factor.
Kittens and fleas, okay.
Yeah, and something like 83% of human cases actually involve a cat scratch. It's not just being near them. And get this, if someone in a household gets Bartonellosis, the chance that their cats test positive for exposure is super high, up to 95%.
That really drives home the connection, doesn't it? So close contact, scratches, young cats, fleas,
Yeah.
all big risk factors for people. What about the severity? Does anything influence whether it's just localized or becomes more widespread?
Yes, the sources point to immune status. For people with a healthy immune system, the infection tends to stay more localized, the initial papule and the regional lymph node. But for individuals who are immunocompromised, there's a significantly higher risk of it becoming a systemic infection, spreading throughout the body.
That makes sense. And for dogs, what are their main risk factors?
For dogs, the key risks seem to be exposure to ticks and fleas, those vectors we talked about, and also living in more rural environments, likely because that increases the chance of encountering those vectors.
Okay. And you mentioned there are different types of Bartonella bacteria. Can we quickly touch on those?
Sure. It's not just one single bacterium. The sources list several species. For feline infections, the main one for CSD is Bartonella henselae. But cats can also carry others like B. clergi, B. cholerae, B. bovis, and even B. quintana.
Okay.
And in dogs, the list is even broader. It includes B. vinsoni subspecies Percoffi, B. henselae again, B. clergi, B. washoensis, B. quintana, B. rocalimae, and B. elizabethae. So quite a few different species can be involved depending on the host.
Right. Knowing the specific species might be important for diagnosis or treatment sometimes, I guess.
Potentially, yeah, especially in more complex or atypical cases, or for research.
Okay. So shifting gears to diagnosis. Someone has symptoms, maybe that swollen lymph node, they remember playing with a kitten. How do doctors actually confirm if it's Bartonellosis? What's the process?
Well, in humans, diagnosis often starts by thinking about other things that cause swollen lymph nodes, because that's quite common, especially in kids and young adults. Benign adenopathy is actually the most common cause.
So they rule out other stuff first.
Exactly. But then a history of cat contact, especially a scratch or bite, plus seeing that initial papule at the site, those are really strong clues pointing towards CSD. The whole clinical picture, particularly that unilateral regional lymphadenitis we discussed, is key.
So the story and the physical exam are really important. Are there specific lab tests then?
Yes, serologic tests are commonly used. These are blood tests looking for antibodies the body makes against Bartonella henselae. The main method mentioned is an indirect fluorescent antibody assay, or IFA.
Okay, blood tests for antibodies.
Right. And interestingly, the sources note that skin tests, which apparently used to be a thing for CSD, are no longer used or recommended.
Good to know.
And yet, doctors also need to consider and rule out a whole list of other conditions that can cause swollen lymph nodes. Things like other bacterial infections, lymphogranuloma venereum, syphilis, TB, fungal infections, even things like sarcoidosis, toxoplasmosis, mono, or unfortunately tumors. So it's part of a differential diagnosis.
Right, lots to consider. And in dogs, you mentioned co-infections.
Yeah, because dogs often get Bartonellosis via ticks. They might also pick up other tick-borne diseases at the same time, like ehrlichiosis or babesiosis. So veterinarians might test for those too if a dog presents with suggestive signs.
Makes sense. Any other lab tests mentioned besides the antibody test?
Our sources also mention enzyme immunoassays, or EIAs, which are another type of antibody test. And then there's culture, actually trying to grow the Bartonella bacteria from a sample, like from a lymph node.
Can they do that easily?
Well, it's possible, but the sources emphasize it's quite difficult. Bartonella are slow-growing and need very specific specialized conditions in the lab. It can take weeks to get a result if it grows at all.
Ah, so not a quick test then.
Definitely not.
Hmm?
There's also PCR polymerase chain reaction. This test looks for the bacteria's genetic material, like DNA, in samples from lesions or blood. That can sometimes be faster and more sensitive than culture.
Okay, so several tools in the diagnostic toolbox, but it sounds like the clinical picture and antibody tests are often central for CSD in humans.
That seems to be the case, yeah.
All right, so we've covered what it is, how it shows up, the risks, the diagnosis. Let's talk treatment. What happens once someone or their pet gets diagnosed?
Okay. For most human cases of cat scratch disease, the really important takeaway is that it typically gets better on its own. It's self-limiting. So often, specific treatment isn't even needed.
So just let the body fight it off.
Pretty much.
Yeah.
Supportive care is often the main approach. Things like rest, maybe applying warm compresses to the swollen lymph nodes to help with discomfort. In some cases, if a lymph node gets really large and filled with fluid, a doctor might need to drain it using a needle that's called aspiration.
Okay.
And basic wound care is important to thoroughly cleaning any cat scratches or bites right away with soap and water. And maybe, obviously, preventing cats from licking any open wounds you might have.
Good hygiene advice. So if it usually gets better on its own, are antibiotics generally not used for people?
That's what the sources suggest for the typical, uncomplicated CSD in people with healthy immune systems. They state that specific antimicrobials are generally not considered efficacious, meaning they don't really speed up recovery significantly in most cases.
Huh. Interesting. But what about those more severe cases you mentioned, or people with weaker immune systems?
Right, that's the exception. In severe cases, or for immunocompromised patients, antibiotics are often used. The sources list several possibilities, like gentamicin, doxycycline, erythromycin, or azithromycin. The choice might depend on susceptibility testing if possible, or clinical judgment based on the severity and location of the infection.
Okay, so antibiotics are reserved for more serious situations in humans. What about dogs? You said they often get sicker.
Yeah, for dogs, the approach seems different. The sources state that optimal therapy isn't definitively established yet, but treatment likely involves a longer course of antibiotics, often for about 4 to 6 weeks. Macrolide antibiotics like azithromycin or erythromycin are frequently mentioned.
Long-term treatment for dogs, then.
Seems to be the general approach, yes, though it's still an area being researched.
And finally, prevention. What's the key advice to avoid getting Bartonellosis in the first place?
The single most emphasized piece of advice, especially highlighted for immunocompromised individuals, is to consider avoiding young cats, particularly kittens under 1 year old, as they are the most likely age group to be bacteremic, meaning having the bacteria in their bloodstream.
Okay, that's a very specific recommendation for certain people. What about for everyone else?
For the general population, it really comes down to good hygiene practices, washing hands thoroughly after handling cats, especially before eating. Cleaning any scratches or bites promptly and properly with soap and water is crucial.
Makes sense.
And, importantly, effective flea control for your pets, cats, and dogs.
Mm.
Since fleas are a primary vector, reducing the flea population on your pets significantly reduces the risk of the bacteria being transmitted.
Right, control the taxis, control the spread.
Exactly.
And just to round that off, the sources did mention complications again briefly at the end.
Yes, just to reiterate, they reassure that serious complications from Bartonellosis in humans, while possible as we discussed with the atypical forms, are generally uncommon for most people who get infected.
Okay, good. So let's try and wrap this up then. If we had to boil down the key takeaways from this deep dive into Bartonellosis, what would they be?
Well, I think the main points are Bartonellosis, often seen as cat scratch disease, is usually a mild infection linked strongly to cats, especially kittens, and spread by vectors like fleas.
Mhm.
In humans, it typically causes that characteristic swollen lymph node near a scratch and often resolves on its own, although a surprising variety of other, sometimes more serious symptoms can occur, particularly in immunocompromised people.
Right, that variability is key.
Definitely. And then there's the animal side. Cats are often silent carriers showing no signs, while dogs seem to be susceptible to a wider range of more significant health problems from Bartonella.
Okay, good summary. Mild but varied in humans, often silent in cats, potentially worse in dogs, and fleas are major players.
That about covers the basics, yeah.
So here's maybe a final thought for you, our listener, to chew on. Considering how adaptable these Bartonella bacteria clearly are, and the fact that our understanding of their effects, especially in animals like dogs, is still evolving, what other, seemingly harmless everyday interactions we have with our pets might actually have more complex health underpinnings than we currently realize?
That's a really interesting question. Makes you think, doesn't it?
It does. Definitely something to ponder next time you're dodging those playful kitten claws.